All right, just letting everybody in. Participants rolling in. Okay, they'll continue to roll in. So I'm going to get started quite quickly tonight. So, good evening, everybody. Welcome to tonight's Transplant Talk Live, the Arrow Foundation's webinar series. We're very fortunate to be able to provide our audience with some amazing topics relating to all things BMT. And tonight, we have quite an important one, particularly for our patients and carers. This is all about a very important role in the social worker and your journey with BMT. So, I'm Angela. I'm the Patient Liaison Coordinator with Arrow, and I'm joining you today from the traditional lands of the Wadawurrung people in the Geelong region of Victoria. I have with me this evening our wonderful host, Yvonne Panic Hudson. She's, amongst many things, a clinical nurse practitioner in haematology at the Peter MacCallum Cancer Centre and the Royal Melbourne Hospital. She's also the co-host of the fabulous and very informative podcast, The Straight and Marrow, and she's one of the directors on our Arrow board. Yvonne is coming to us tonight from the traditional lands of the Wurundjeri people in Naarm, Melbourne. Along with Yvonne, we are very fortunate to welcome our lovely panellist tonight, Melissa Weinstein. She's a senior social worker at the Royal Melbourne Hospital in the bone marrow transplant unit, and she's also joining us tonight from the traditional lands of the Wurundjeri people in Melbourne. I'll shortly hand over to Yvonne, who will be facilitating our Q&A on completion of Melissa's presentation. So please, if you do have any questions throughout the session, pop them in the Q&A, or you can use the chat section, and we also always encourage you to chat amongst each other if you like through that chat section. We'll continue to monitor that throughout the evening. We do please need to keep in mind that we are unable to answer any questions regarding to your own diagnosis or own health status at this time. So if anything does come up throughout this session, we ask you to please consult with your treating healthcare teams. And obviously, we also always encourage you to head to your GP if you're not currently within the system, and they are always a great port of call for you. So please enjoy tonight's webinar. It is going to be a really lovely one to listen to. And without further ado, I'm going to hand over to Yvonne. Thanks, Yvonne.
Thanks, Ange, and thanks to Arrow again for supporting these webinars. I'm really delighted to be hosting tonight's webinar and to welcome Melissa. And thanks for that great introduction, Ange. Social workers are really the pinnacle of the patient and family experience during an allogeneic bone marrow transplant, an autologous transplant, and CAR T-cell therapy. They do so many wonderful things, and Melissa will tell you about that tonight. But in addition to practical support, providing emotional and psychosocial support is a really important part of what they do. As a nurse, we work really closely with social workers and really value that relationship. So without further ado, I'd like to welcome Melissa to present to our audience tonight, and we really look forward to your questions after the presentation. Thanks very much, Melissa.
Thank you. I'm just going to share my screen. Just give me a second. Is that good?
Perfect.
Yep. Okay.
Perfect.
Okay, great. So good evening, everyone. Thank you for joining me. Yes, my name's Melissa. Thank you for that introduction. I'm a bone marrow transplant social worker at the Royal Melbourne Hospital, working within the joint Royal Melbourne and Peter MacCallum Cancer Centre bone marrow transplant program. That's a mouthful, which is the largest allogeneic bone marrow transplant service in Victoria and the second largest in Australia, performing around 100 allo transplants each year. I've worked as a hospital social worker for more than 23 years, and while the examples I'll share are drawn from our service, many of the psychosocial challenges experienced by patients and families are common across bone marrow transplant programs, really across Australia or the world. Tonight, I would like to explore the transplant journey through a social work lens. We'll look at the emotional, practical, and family impacts of allogeneic bone marrow transplant and the role of the social worker in supporting patients and families from before transplant through recovery. And excuse me if I cough, I have had a chest infection, so it's not catchy through the screen, but I'm sorry if I cough at any point throughout. So I'd just quickly like to acknowledge the traditional owners of the lands on which we meet and which we each gather today. I pay my respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. Okay, so before we talk about bone marrow transplant or the role of the social worker, I'd like to introduce you to someone I'll call Danielle. Danielle is 42 years old. She's married to Tom, and together they have 2 young children. Until recently, life looked much like it does for many families, busy balancing work, school, weekend sport, and plans for the future. Then everything changed. She was diagnosed with acute myeloid leukemia, and after several rounds of treatment, she was told she would need an allogeneic bone marrow transplant. They were relieved that the transplant was an option, while also feeling frightened by what lay ahead. They had little idea how much the transplant would affect every part of their lives. Like many of our patients, Danielle and Tom temporarily relocated from regional Victoria to Melbourne for treatment, leaving behind their home, their community, and much of their usual support network. Although Danielle is fictional, her story reflects the experiences of many of our patients and families we care for. Throughout my presentation tonight, we'll come back to her story to explore how social workers support patients and families at different stages of the transplant journey. So, some of you will be very familiar with what an allogeneic bone marrow transplant is, while for others, this may be completely new. Before we talk about psychosocial care, I'd like to briefly explain what an allogeneic transplant involves, as that's the focus of tonight's presentation. Although it's commonly called a bone marrow transplant, most transplants today use healthy blood-forming stem cells. Unlike an autologous transplant, which uses a person's own stem cells, an allogeneic transplant uses stem cells from a donor. These stem cells are infused through a drip, like a blood transfusion, before traveling to the bone marrow where they rebuild the blood and immune system. People are often surprised that the stem cell infusion itself is relatively straightforward because it isn't an operation and it's often much less dramatic than people imagine. At the same time, day 0 is often one of the most emotionally significant days of the transplant journey. Many patients have described it to me as their second birthday, marking the beginning of rebuilding their blood and immune system and hopefully a healthier future. Before transplant, patients receive intensive chemo, followed by several weeks in hospital while the donor cells engraft and the new immune system begins to develop. This is often the most physically demanding stage of treatment, with patients becoming unwell and highly vulnerable to infection and other complications. Recovery then continues for many months after discharge. This timeline helps to explain what happens during the transplant. What I'd like to focus on now is what it actually feels like to live through it. So, look, while every serious illness brings its own challenges, allogeneic bone marrow transplant has several features that make the experience unique. Following discharge, patients are generally required to remain within around 45 minutes of the hospital and have a dedicated 24-hour carer. They're still medically fragile, often attending the outpatient clinic several times a week, and can become unwell very quickly if complications arise. For many families, this means relocating, taking extended leave from work, relying heavily on others, and temporarily giving up much of the independence that they were used to. For many patients and families, transplant becomes the center of everyday life. They have appointments, blood tests, medications, infection precautions. They begin to shape every daily routine and their decisions. Although recovery milestones help guide expectations, no two transplant journeys are exactly the same. Setbacks and complications can occur unexpectedly, making it very difficult for people to know what lies ahead. And while one person is receiving the transplant, the whole family is affected. Carers often take on new responsibilities while balancing work, finances, parenting, and their own well-being. One of the things I often say to patients is that leaving hospital doesn't mean the transplant's over. It's simply a different part of the journey with a different set of challenges to navigate. That's also where social work continues to play an important role, supporting patients and families as those challenges change over time. So, we've just seen that transplant affects far more than physical health. It changes relationships, family life, finances, work, confidence, and often a person's sense of who they are. And that's where psychosocial care comes in. It looks beyond the disease and the treatment itself to understand how patients and families are experiencing and adapting to life throughout the transplant journey. Psychosocial care recognizes that emotional well-being, practical circumstances, relationship, and social supports all influence how people cope with treatment. One thing I've learned is that emotional distress isn't a sign that someone isn't coping. It's often a very normal response to an extraordinary experience. Feeling anxious, overwhelmed, uncertain, or grieving the loss of your previous life can all be part of the transplant experience. I've also learnt that people can hold two seemingly opposite emotions at the same time. They can feel incredibly grateful that a transplant is an option, while also grieving what they've lost because of it. They can feel hopeful and frightened at the same time. Those emotions aren't contradictory, they can exist side by side. Part of psychosocial care is creating space for all of them rather than people feeling they have to stay positive all the time. Research consistently shows that psychosocial care improves quality of life and helps people stay engaged with their treatment. It also strengthens the support around the patient because carers and families who feel supported are better able to support the person they love. And that's why psychosocial care is now recognized as an essential part of high quality bone marrow transplant care. So, while I'll be focusing on the role of the social worker tonight, it's important to remember that psychosocial care is delivered as part of a multidisciplinary team. We work closely with psychologists, nurses, doctors, and other allied health professionals to ensure patients and families receive the support that's most appropriate for their needs. One of the questions I'm asked most often is, what does a social worker actually do? At its heart, social work is about understanding the whole person, not just the diagnosis. Hospital social workers support people through a wide range of psychosocial challenges, from trauma and homelessness to aged care and disability, grief, and complex family situations. In bone marrow transplant, those challenges arise within the unique context of transplant. For me, one of the things I value most about social work is that we have the privilege of really getting to know people and what's important to them. We take the time to understand not only what's happening medically, but also the family, relationships, values, and circumstances that shape their experience. Because every transplant journey is different. Our role evolves as people's needs change. Sometimes we're providing counselling or supporting families. Other times we're advocating, coordinating services, or helping people navigate the practical realities of transplant. Whatever we're doing, the goal is always the same. We're helping people feel informed and supported and hopefully a bit less overwhelmed. So rather than describing the role in abstract terms, I would like to show you what that looks like at each stage of the transplant journey. Our involvement usually begins in the weeks leading up to transplant as part of the pre-transplant workup. At the Royal Melbourne Hospital, every patient undergoing an allogeneic bone marrow transplant is routinely referred to social work, and that's me at the Royal Melbourne. People sometimes imagine this is simply a one-off assessment, but in reality, it's the beginning of a relationship. I often say to people, you're stuck with me now, which patients and families actually do find very reassuring because they know I'll be there throughout their admission and into recovery. It's our first opportunity to understand what's important to the person, the people who matter most to them, and their cultural, spiritual, and personal factors that may shape their transplant experience. Understanding those things also helps us advocate for care that's tailored to them. For some people, that might mean supporting the team to adapt their communication, considering sensory or accessibility needs, or advocating for environmental changes that help someone feel safer and better able to cope with treatment. A psychosocial assessment isn't just about identifying problems, it's about understanding how transplant is likely to affect that person's life, recognizing the strengths they'll draw on, and identifying where additional support might be needed. I'm often just as interested in how a family has coped with previous adversity as I am in how they're coping today. Who do they turn to when life becomes difficult? What gives them hope? Those strengths are often just as important as identifying where they need extra support. We also recognize that people don't all start from the same place. Some families have strong financial and social supports, while others are already facing significant challenges before transplant even begins. Part of our role is identifying those barriers early, advocating for patients and families, and helping connect them with the support they might need. We're also helping people understand what everyday life throughout the transplant is going to look like. Sometimes we're meeting people or meeting someone who lives 7 hours from Melbourne and they haven't realised they'll need to stay nearby for months after discharge. Together, we're working out where they'll live, how they'll afford it, and who can provide the support they'll need. One of the biggest challenges is often the requirement for a dedicated 24-hour carer. Not everyone has someone who can simply step into that role. And even when they do, it's often far from straightforward. A carer might need to take extended leave from work, have health issues of their own, or already be caring for children or elderly parents. Part of our role is helping families understand why that support is so important, explore who might be able to help, and sometimes think beyond a single primary carer by sharing the role across family and friends. We're also thinking ahead to what happens if those plans change. For example, if a carer becomes unwell themselves or unexpectedly has to return home. Other conversations are about explaining transplant to children, managing the financial impact of time away from work, or preparing for the unexpected, as I said. That may include discussing who they would want to make medical decisions if they become too unwell to speak for themselves, ensuring they have those legal documents and that they're up to date, and helping families have important conversations before treatment begins. These conversations can feel confronting, but they're really about helping people feel prepared and giving families greater clarity if difficult decisions ever need to be made. Because every person's circumstances are different, every psychosocial assessment is different. By identifying these issues early, we can often put the supports in place before the treatment begins, rather than trying to solve problems in the middle of a crisis. For Danielle, the example I presented initially, this was when the reality of transplant really started to take shape. Together, we planned her temporary accommodation close to the hospital, prepared her husband Tom for his role as her carer, and began talking about what the transplant would mean for their children. So, having those conversations early didn't remove the uncertainty, but it meant they felt better prepared and knowing that they hopefully didn't feel alone in that. Supporting patients, yes, during hospital admission. So, once patients are admitted, our role naturally evolves. Hospital admissions, as I mentioned before, often last several weeks. They're coping with intensive treatment, side effects, infection precautions, and long periods away from home. For many, it's the first time they've been separated from their usual routines, families, and support networks for an extended period. There's also the emotional weight of waiting for the blood counts to recover, waiting to see where the complications develop, waiting to find what comes next. This is often when the reality of transplant really starts to sink in, and it's not uncommon for people to feel anxious, homesick, frustrated, or wonder if they'll ever feel like themselves again. Sometimes our role is simply just helping people make sense of what's happening. Transplant rarely follows a straight line, and when plans change unexpectedly, people often need time and space to process what that means for their family and for them. So, no 2 days look the same on the ward. One day we might be helping parents find the words to explain what's happening to their children. The next, we might be facilitating a family meeting, advocating with the multidisciplinary team, beginning to plan for discharge, or simply sitting quietly with someone who's feeling frightened or overwhelmed. Sometimes a patient's main support person, as I said before, becomes unwell themselves, and suddenly we're helping a family reorganize everything. One of the things I've learned is that people often feel they have to stay positive for everyone around them. Part of our role is creating a space where they don't have to. They can feel angry and scared and exhausted, and those react and know that those reactions are understandable. That continuity also matters. So over weeks and months, trust develops, and for many patients, a familiar face becomes the source of comfort and stability. Honestly, I see that. It's lovely to be able to have that continuity. Um, so as we've seen, many of the challenges of transplant extend well beyond medical treatment. I've covered this already, but just to reinforce that they're often navigating the accommodation, finances, travel, employment, and many practical demands that come with it. So, an important part of the transplant social worker's role is helping people understand what support is available, advocating for them, and connecting them with the right organisations and services at the right time. So the organisations on this slide are some of the services we work closely with, although there are many others depending on the person's circumstances and where they live. Specifically, there's a couple of other ones down in Tassie that I connect with, but I would say these are some of the main ones that we mostly use. So we might arrange accommodation for people through the Leukemia Foundation or Fight Cancer Foundation at the BMDI, Bone Marrow Donor Institute House, and those places are across the road from the hospital. Assist with Centrelink and all the applications that come with that, and the medical reports to assess eligibility for support through financial support. We support people with patient travel subsidy schemes if they're coming from rural Victoria or interstate. Coordinate existing supports that they might have. That could be the NDIS or My Aged Care. And we also connect people with wonderful organisations like the Arrow Foundation, Cancer Council, or the Carer Gateway, who all provide different types of financial and practical and emotional support. We also advocate across a range of systems by writing support letters for people's employers, insurers, visa applications for family members to come and be carers here, and working with government and community agencies to help remove barriers to treatment. As I've said, every patient and family is different, so there isn't a single pathway. Part of our role is understanding each person's circumstances, knowing what supports are available, and helping them access the service that best meets their unique need. So ultimately, these interventions don't change the diagnosis, but they can remove barriers that make treatment and recovery more manageable, allowing patients and families to focus their energy on what matters most. Okay. So while we've spent a lot of time talking about patients, transplant never affects just one person. It affects the whole family. While one person receives the transplant, everyone around them is adapting too. And even in very supportive families, people often experience the same journey in very different ways. Partners can become carers almost overnight. Parents are trying to reassure their children while managing their own uncertainty. Families are adjusting to new routines, new responsibilities, and a future that they didn't plan for or expect. Um, One of the things I learnt through my family therapy training is that when one person becomes ill in a system, a family, everybody adapts. So roles shift, communications change, there are communication changes, relationships have to find a new balance. Often it's those changes within the family, not just the medical treatment, that people find the hardest to navigate. I've seen couples who have always shared everything suddenly find one person become the nurse, the organizer, the decision maker, while the other one struggles with losing their independence. Other times, the primary carer isn't a partner at all, but a friend, a sibling, or another family member who unexpectedly steps into the role. Living together in temporary accommodation for weeks or months can also place enormous pressure on relationships. Although transplant does place that enormous pressure on families, I've also seen it strengthen relationships. Families often discover strengths that they didn't know they had, and they find new ways of supporting one another through incredibly difficult circumstances. I often meet carers who apologize for crying because they feel like they have to be the strong one. One comment I hear often that is, I have to stay strong because everyone's focused on the patient. Many carers put their own lives on hold. They spend months coordinating appointments, managing medications, supporting children, balancing work, and trying to hold everything together. I've met carers who tell me they haven't had a haircut, they haven't caught up with a friend for months because every ounce of energy has gone into looking after someone else. Part of our role is creating space for those carers too, to talk openly about how they're coping, ask for help without feeling guilty, and recognize that their well-being matters. We're also thinking about the children and young people in the family. A 5-year-old, a 12-year-old, and a young adult will all understand and respond to a parent's illness differently. Part of our role is helping families have those age appropriate conversations, supporting children to understand what's happening, and linking families with additional support when it's needed. We also reassure carers that looking after themselves isn't taking anything away from the patient. It helps them actually continue caring for the person they love. Just as importantly, we help normalize what they're experiencing. Feeling overwhelmed, exhausted, or emotionally drained doesn't mean they're failing. It means they're responding to an incredibly demanding situation. So sometimes that will mean counseling and sitting down with a carer by the bedside or going into a separate room and providing support or facilitating a family meeting with the doctors so that they can access more clear information. Other times, it's helping carers access support, such as the Centrelink carer payment, the carer allowance, connecting with the carer gateway, or negotiating leave and flexible work arrangements with their employers. Because we saw this need so often, our social work team developed an online bone marrow transplant support group, which I facilitate every 6 weeks alongside one of our wonderful bone marrow transplant clinical nurse coordinators. It's become a space where carers can share their experiences, learn from one another, and realize that they're not alone. So, as we've established, supporting carers isn't separate from supporting patients, it's an essential part of our transplant care. Many people, so recovery after discharge, many people spend weeks counting down the days until they can finally go home. Discharge feels like the finish line. Then I often hear something like this, I thought things would feel easier once I got home. And I think that that one sentence honestly captures the transplant experience better than almost anything else. 'Cause leaving hospital is an important milestone, but it's really the beginning of a different phase of recovery. Patients are adjusting to life outside the hospital while they're still attending their appointments, taking their medications, and living with the ongoing demands of the transplant. Something that continues to strike me working in bone marrow transplant is how much kinder patients are to themselves while they're in hospital than once they're at home. In hospital, people know they're unwell and they allow themselves time to heal. But once they're home, many expect themselves to be getting back to normal much more quickly than their bodies are ready for. That gap between expectation and reality can feel incredibly frustrating. I've also noticed how much significance people attach to the transplant timeline. Patients often know exactly what day they're up to: day plus 12, day plus 30, day plus 100, and that's completely understandable. Those milestones become something to work towards, and that's complete and at the something to work towards, and often carry expectations about how they think they should be feeling. When they reach a particular day and they're still exhausted, still anxious, or dealing with setbacks, it can be incredibly disappointing. It's not unusual to hear people ask, "Am I ever going to get better?" I often remind people not to compare themselves with someone else's day 100. Every transplant journey is different, and recovery rarely follows the timeline we imagine. And alongside that physical recovery is something else. It's learning to trust your body again. Every time you get a new temperature, every ache, every unfamiliar symptom, that can trigger understandable anxiety, leaving people to wonder, Is this normal? Should I be feeling this way?" So going home, it isn't about getting back to the person you were before transplant. It's about gradually rebuilding a new normal, finding new routines, reconnecting with family, rebuilding confidence, and when the time is right, returning to work and with the parts of life that matter the most to you. One of the privileges of working in bone marrow transplant is that we don't just see people during the hardest parts of their journey. We also have the privilege of seeing many of them years later living full and meaningful lives. Recovery isn't always quick or straightforward, but those moments remind us that transplant is as much about getting through the treatment as it is about rebuilding the life afterwards. For Danielle, the woman we used as an example earlier, going home brought a different set of challenges for her. She still needed a lot of reassurance when her new symptoms appeared, support as new challenges arose, and someone who understood that recovery wasn't always straightforward. And that's why the social work support doesn't always end at discharge. People's needs continue to change, and we continue supporting them just as they adjust to their life after the transplant. So for many people, that's exactly what recovery looks like. But unfortunately, not every transplant journey follows that path. And while many patients recover well after transplant, not every journey unfolds as people hope. Some experience significant complications, some relapse, and for others, treatment goals change. These are some of the most difficult conversations we have in transplant care. Families are often trying to absorb overwhelming information while continuing to support one another and make incredibly difficult decisions. During these times, I've come to appreciate how different people cope with those situations. So it's not unusual to see one partner wanting every piece of information while the other can't bear to hear another conversation about prognosis. Neither approach is wrong, they're simply just different ways of coping. So, part of the social work role is helping families understand one another during these times and recognize that there's no right way to cope. And I guess I've also learned that supporting hope doesn't always mean hoping for a cure. Sometimes hope changes, and I've seen it become the hope of getting home one more time, attending a daughter's wedding, meeting a new grandchild, or simply sharing another family dinner together. Rather than trying to take away uncertainty, we help people and families, find a way to live alongside it. So as the treatment goals change, our role changes too. Those practical tasks I mentioned earlier become less prominent, and more time is spent helping families make sense of those difficult decisions, facilitating conversations, working with the team, and just being present with them. So, when care shifts toward comfort and quality of life, our involvement continues. Our role doesn't end when a patient dies. We continue supporting families through bereavement by offering follow up contact, grief support, and opportunities to meet with the team, ask questions, and reflect on what they've experienced, whilst also connecting them with ongoing bereavement services when needed. And although these moments are some of the hardest parts of our work, they've taught me that our role isn't always to change the situation. Often it's simply to just help people feel seen and heard and a bit less alone as they move through it. And particularly with someone who's known them from pre transplant and through the hospital, there's something about that continuity through some of the more difficult times that's a real privilege for us and special for um, patients and families. So, look, as I was preparing this talk, that there's so much to say and so many thoughts in my head, but I found myself coming back to one question. I guess after everything that people go through during a bone marrow transplant, what actually stays with them? And after more than 23 years as a social worker, I'm still surprised by what people remember. If we think back to Danielle, my woman from the beginning, I imagine she'll remember many of the practical things that helped her family get through transplant, the problems that were solved, the support they received, and knowing there was someone there to help them navigate the countless challenges that arose along the way. Those things matter, and they did make an enormous difference to her and to her family. But I also hope that she'll remember how she and her family were made to feel, that they felt listened to and understood and supported, and that there was someone there who took the time to understand what life was like for them, and walk with them through that journey. So, in my experience as a social worker, that is often what stays with people. Um, they remember the support they receive, but they also remember how that made them feel. So, without that sounding like a cliche, I think that is extraordinarily important at a time when everything can feel very overwhelming. Um, so, I've talked fast, but that is it. Thank you for spending this time with me tonight. I hope that it's given you a deeper understanding of the human experience of bone marrow transplant and why psychosocial care is such an important part of high quality transplant care, and the importance of social workers in this space. So I'd be really happy to answer any questions. Thank you.
Thank you, Melissa. That was a phenomenal presentation, and look, gave me, who is in the system, such a wonderful, rich overview of the role of the social worker and the enormous benefit that you and your colleagues bring to patients and family experience. Now, I know you can't comment on individual transplant centres or people's individual experiences, but someone has very kindly and really bravely posted a question about their husband who has had chemotherapy and CAR T and is likely going to need an allogeneic stem cell transplant. They've got primary school age children, and their experience has been quite different in terms of social work engagement. They're asking you how you would advise they navigate the journey ahead of them, given their experience has been quite different with social work support.
Look, every unit, every transplant unit, every hospital, every individual social worker is going to be different. I guess I would encourage you to ask be really clear in asking for social work support in some different services. Perhaps it's a referral base rather than what we offer, which is what's the word? I see every
Automatic.
automatic. Yeah, I
Yeah.
see. We would do 100 transplants a year. I see 100 people.
Mm-hmm.
That's the system, and that's the staffing, and all the things that we have as available. I can't speak to other hospitals and what they offer, but I would imagine that they would have a social worker that could be assigned to come and see you and provide some of these supports, and some of the resources that I shared about those community organisations as well, you may be able to connect with. But certainly reach out and ask within your team for that additional support.
Yeah, I completely agree with that, Melissa. So certainly advocate for yourself and for your family, ask your team, have the conversation. I would recommend having the conversation with your transplant nurse coordinator or nurse consultant, because they work really closely with social work, and they may be able to provide you with other resources as well. So, Melissa, just kind of extending on the participant's question. So, what specific external resources would you recommend, given they sound like a young family with lots of competing things going on in their lives? Are there any specific? I mean, obviously, Arrow. Reach out to Arrow.
Yeah.
What other resources would you recommend?
So I think the Leukemia Foundation is always my go-to for anyone who has a blood-related illness. So I'm not sure what the diagnosis is, but if you're eligible for support um, through, we do have patients that have transplants that don't have blood-related illness. Majority do. So if you're eligible for Leukemia Foundation, they're wonderful. They have a wealth of information, resources, and practical support. Things like fuel vouchers, grocery vouchers, the emotional support, plus I don't know where you live, but if I didn't hear if you said you needed to relocate. But if you have also for young children, or depending how old they are, I think Canteen is a great organisation that even if you just use their website, they have different resources for children of different ages. So how to talk to kids, like I mentioned, you'll explain it to a 5-year-old very differently to how you'll explain it to a 16-year-old. They offer counselling for kids. So it's not just Canteen's not just for kids experiencing cancer, it's for kids of a parent or sibling as well. So I think they're two excellent organisations. And even kind of letting the school know, often even will do that, but I would say, that perhaps the mum or dad could ring the school and just let them know that there might be changes in behaviour or changes, just that this is going on, huge change in a family with a sick parent. So it can impact lots of different parts of their life. And I guess the other thing I'd say is financially, if that's going to impact changes for work for the patient and for the carer, looking at things like income protection or accessing Centrelink, doing all of that early. Centrelink's a headache. It'll take a long time to get through all that paperwork, but it's absolutely worth it. Because as I have said through this presentation, it's a long journey. So if you can get some financial backing or support through that, don't feel bad about that. I would do that straight up. And the sooner you apply, the better for that kind of thing. Does that answer it?
Yeah, absolutely. And, if, look, again, if you're not getting the support you need, ask for it again and again and again. And in terms of filling in paperwork, of which it is, can often be a huge amount of paperwork and phone calls dealing with Centrelink, getting a close friend who you trust to help you with filling in paperwork, because obviously your attention is, occupied elsewhere, and it's understandable to become overwhelmed with the magnitude of all of the things you've got to manage, particularly as a carer. So having some trusted people around you to help support you to manage those things, I think, is really important. And
Absolutely.
say yes to help.
Yeah, definitely say yes to help.
Say yes to
You
help.
and I guess the other thing is, you do it for them. That's what I often say, is people often feel like a burden or say, I don't want to ask for help. And we say, if they asked you, we said, would you show up for them? And they would,
Yeah.
for better or worse in marriage, that's what we're here for. So it is the worst. This is the bit that's hard, but there's better. And that's why you're doing the transplant. And I don't want this to be feel frightening, everything I've said, but there's the reason you do it is hopefully for a curative outcome and to have a long, beautiful life. So it's just a hard road getting there. So I have a lot of empathy for people going through it.
So, Melissa, there's some lovely feedback. People have really enjoyed your presentation. There is a comment from James to everyone. So thank you for a wonderful presentation, Melissa. My husband had an allogeneic transplant in December 2025, and our experience of social work was so helpful. One really helpful thing she explained was that when the day of discharge arrives, you may not feel ready to go
Yeah.
home, and this is normal. She was really useful in forward planning and signposting things ahead. That's such a great comment, James.
Yeah.
Melissa, would you like to comment on that?
Yeah, I mean, absolutely. I think people do often think they will feel much better by the time they're ready to go, when in reality, um, they're good enough to go. So I often feel that it's a little bit like, you're good enough. We're letting you go home, but you're coming back to clinic twice a week. Therefore, you're still so fragile with your immune system. There's still so many things that need medical attention. And so, yeah, there is that feeling. And I think I mentioned it in my talk about when you're in hospital, you're kind of, I'm sick. People come and visit you, and you sort of expect to feel really unwell. But there's that expectation that, well, by this day, when I'm ready to go, I should be feeling better. And the hard thing is that people also feel like that 2 months down the track, and they still have that expectation. So it's about really moderating your expectations at each point of that journey, but knowing that there is a light at the end of the tunnel. It's just a long tunnel. But being gentle and kind to yourself about, the discharge date from hospital, we are letting you go, but that is why we say a 24-hour carer. That's why we say be close to the hospital, because it still is considered intensive treatment. So I think that is important. People don't always think that. And the other thing I'd add is sometimes I meet family members who say, I'm going to take off the month from work while they're in hospital, and then I'll go back to work when they come home. And I say, flip it. Take your
Yeah.
month off the first month. You don't, as lovely as it is for you to sit with your husband while he's in hospital, he doesn't need, he needs you for emotional support, but we're doing it all. He needs you when you go home. That's the month to take off. So I sort of stress a lot of that in the pre-transplant workup, is planning for that.
That's such good advice, Melissa, because, for some people, they can take a lot of time off, but for some people, taking time off is really difficult because
Absolutely.
their jobs demand them to be available, or there's financial stress. So that's really fabulous advice. The other point I wanted to make around the day of discharge, and you mentioned, day 100, and we do timestamp a lot in bone marrow transplants. And, when we're educating people, we talk a lot about, going home around about this date, and, your transplant's day 0, and, day 100, all of this happens. But it's a very kind of flexible figure. But I think, people do become attached to those timestamps, and so it's really important that we provide people with some context around those as well, just so people aren't so hard on themselves. That that it's okay not to feel completely ready to go home. When we say they're ready to be discharged, people feel very vulnerable. We've protected them, we've had them in isolation.
Yeah, there's a lot of fear.
There's a lot of fear. So yeah, we need to contextualize that well, I think. So there's some wonderful feedback, an insightful presentation. Melissa, thank you for all the important work you do. Jana from Arrow said, such a wonderful presentation. Thank you, Melissa. I'm very lucky to work with Melissa on a daily basis, supporting BMT patients and their carers. Her dedication and care is absolutely incredible. Tanya has said, I've just arrived home 1 week ago after my stem cell transplant. Congratulations, Tanya. What a journey. Discharge was hard and emotional, but glad I'm home.
Mm.
Yeah. So what are some of the emotions that people tell you when you see them at your first visit with them after they've been home for a week or so?
Yeah, look, I mean, people are connected with Peter Mac after they leave because of our joint service, so it's harder for me to comment to that. But look, whenever I see people down the track, I think it's a mix of things, particularly, look, I can comment on the carer group because I run the carer group, and I see the width and breadth, or whatever the word is, of experience and feelings and emotion that people feel during that time. So, as I said, there's some really positive things that do come out of it. So sometimes people will say that, look, no one's choosing to go through this, but as a consequence of it, sometimes you can have a greater sense of, I suppose, what's important in life, and that idea of not sweating the small stuff. And people will tell me, I just want to be able to be barefoot on the sand because my feet are so itchy and dry, or every time I go barefoot, I get scratched, and I can't do that. So those things strike me because I hear it and think, oh, they're things that I just take for granted. And so the kind of perspective shifts. And the gratitude for who's in their life, and who matters, what they want to do with the rest of their life. So while that intues it, that I guess a consequence of this experience for a lot of people is that they have that kind of greater understanding of maybe what's important to them. And, that's not everybody. There are people that are going to fall into heap and say, this is all too hard and I've lost my job. And, but I'd like to end the presentation on that positive, is that through difficult situations, sometimes we discover more about ourselves and the people around us. But you've got to get through this difficult time, to be able to have that awareness. And some of the most beautiful stories, things that we've heard is, say, somebody connecting with their donor 2 years down the track. I think you'd know more than I do about how they can connect, I think, after a certain amount of time. If they want to connect, you want to connect. And we've had stories where someone's traveled over to the UK, met their donor, and it's just incredible. They've given them the gift of an immune system and a life. So I find that remarkable. It's remarkable medicine, a transplant. But hell of a ride. So I don't know. That's my insights.
Yeah, no, that's as Tanya said, so true. Thank you. And I think everyone would agree with what you've just described, Melissa. That the experience, for some people there are some similarities, but it's very individual. That and what I loved in your presentation was the way you normalized people's emotions, and that people can have parallel emotions as well, be so delighted that they have a donor and can have a transplant, but at the same time be terrified and worry about the future and concerned about their family. So having parallel emotions and normalizing all of that, I thought was really such an important message throughout your presentation. But something that you've talked about there is, and I run the long-term follow-up service at the Royal Melbourne and Peter Mac. So we see people who are 2 or more years post-transplant. We look after hundreds and hundreds and hundreds of people. It's the most wonderful service. People talk about post-transplant resilience and growth and changing mindset. And that's not just people who have, come through the transplant with very few complications. Many, many people, depending on what their experience is, talk about those feelings. Sometimes, as you say, it takes a while because it's, the first couple of years can be quite difficult for people. But it's such a wonderful thing to hear people talk about and really lean into and understand. So thank you for picking up on that as well. Thank you, Melissa, on behalf of Arrow and all our attendees, our beautiful audience that make the webinar what it is. See you next time, everybody, and I'm going to hand you back to Ange.
Thanks so much, Yvonne. And Melissa, that was really fantastic. It was a pleasure learning about your role as a social worker and how very lucky your patients are who you see, because they are absolutely in such good hands. And I think, you always learn so much from these webinars, but how extensive your role is truly remarkable, to be honest. And it just will definitely be making the experience of all these patients, families, carers, everybody involved in transplant, a better time. So thank you for all you're doing in this space. It's remarkable. And to our audience, yes, as Yvonne said, thank you so much for coming along. We really do value your support. We do have a survey always at the end of these webinars. They're anonymous, so please feel free to jump on and fill it in. It takes a very short amount of time to do it, and it just helps us with future webinars. It's often these webinars do bring things up for people. So please do reach out to your teams, to your GP, to your families, whoever that you need to talk to. Please do reach out. Sometimes it is hard to take that leap and have that first conversation, but please do. There is a lot of people out there like Yvonne and Melissa who are absolutely in the best place to support you guys. So please reach out to your teams. And if you need us at Arrow, we are always here to support you. We've got access to you to financial support. We have emotional support services with our Transplant Tribe support group, and we run these webinars. And of course, the podcast, The Straight and Marrow, is a brilliant resource. So please jump on. The links are on our website. And I'm always around. Also, shoot us an email if you ever need to chat or ask any questions or just need to reach out for help. So please keep looking out for our webinars in the future. And thanks again, Melissa, for joining us. Thank you, Yvonne, for your hosting. It's always amazing. And have a great evening, everybody, and we'll see you next time. See you later.
Bye.